When you look at movies, you know, psychiatrists are either depicted as, very eccentric to the point of being odd or crazy, or callous and uncaring. And probably even the worst, they end up falling in love and having romantic relationships with their patients, which is nuts. But that's kind of how it's portrayed consistently, and so there's this, whacked out notion of what psychiatry is, or more particularly what psychiatrists are like. And so people think, well, okay, that's what it is. That and the fact that part of what we do in psychiatry is not just deal with these kind of anxiety or depressive disorders, but we also deal with severe mental illness, things like schizophrenia, people who really have lost touch with reality because of their illness, and those folks really struggle. And since psychiatry does treat that, people go, well, I don't want to be considered like those folks. So even with the more accessibly treatable kinds of illnesses, they tend to stay away from what's been stigmatized. First visit, it's important for me to really get a good idea of who this person is, not just what the illness symptoms are like, but how those illnesses are presenting within the context of this person's whole life. You don't want to just know the pathology and what's not going well. You want to know strengths as well and the things that bring joy to them. You want to get them their life back. That's the whole purpose. So I need to have some idea of what their life is like. That visit usually lasts about 50 minutes and is very in-depth. We cover not just the presenting symptoms, not just what's happened recently, but complete medical history, surgical history, all their medications, social history, family history. I mean, we do the whole enchilada, really wanting to get to know them. Based on that, then we make a course of action. We set up a treatment plan, discuss the risks and benefits of the proposed treatment, and basically do informed consent, because every treatment has its risk of not doing well as its risk of doing exceedingly well. So we talk about those, and then I let patients decide amongst the reasonable treatments which one they'd want to go with, because I work for them after all. They don't work for me. Let's talk about anxiety. Generalized anxiety. People will have often the experience of worrying a lot. They won't be able to let that go. It may interfere with their sleep, that they find that their thoughts just won't shut off at night. And so instead of moving into sleep stages nice and gently, they find that their mind just keeps running around in circles, not productively, but just kind of like a dog with a bone, chewing on the same thing over and over, not getting anywhere, but not getting to sleep either. So having problems falling asleep is often an indication of generalized anxiety. The worry, as I mentioned, which is more of a psychological manifestation, but then there can be physical manifestations. People who have kind of constantly clammy, sweaty palms, or actually may sweat otherwise, feel shaky, feel tremulous, muscle tension, or even not even a direct physical symptom that you can see, but even just a sense of not having any energy, just feeling drained and empty, always fatigued. Those are the kinds of things that may be an indication that someone has a generalized anxiety disorder. So panic disorder, which is kind of a notch above all that, where you may have some of those same symptoms to some degree, but on top of that you have episodes where you feel like something bad is going to happen. Not specifically, you can't put your finger on what that might be, but some shoe is going to drop, some catastrophe is going to occur, and you just have to get away from wherever you are at that moment. And so people feel like they've just got to move, leave that situation. They don't really care where they go, they just want to get out of there. They have this sense of doom. They at that point will have shaking, racing heart, shortness of breath. It feels like you might die. And it feels crazy because there's nothing that you can put your finger on. And these folks end up in emergency rooms getting full heart workups to rule out heart attacks, myocardial infarctions, and they come up with nothing, total goose eggs. And it's like, well, you don't have anything. And then they go home and have another one the next day and end up back in the ER, and they're worked up again because, you wouldn't want to miss a heart attack. And then, usually only after time, does someone say, maybe this is a panic attack, but it can present looking just like a heart attack. All of us have psychological functions. We all have coping mechanisms. That's how everybody gets through life. It's only when a coping mechanism or a style of interaction doesn't work, and when you find that you on your own aren't finding ways to make it work better, that's when you get help. If you're doing well in your life, don't waste your time with psychiatrists, psychologists, therapists of any sort. The whole idea is to be able to enjoy and to be grateful for the life you have. A person I know once said that he's never met an unhappy, grateful man. Gratitude is a really good attitude. If, on the other hand, though, you're doing your best and you're trying to have a positive attitude and you're finding that for whatever reason it's not working, a consultation with a psychiatrist is not a bad idea. It could be something biological that you just aren't going to be able to push through, that you may have to have some kind of medical intervention, which may make things a whole lot more graceful and easy in getting you where you want to go.